Hey guys, and welcome to sqadia.com. Today the topic that I have chosen for us is the radicular cyst. So radicular means the roots of the tooth, whereas a cyst is a fluid-filled cavity which is lined by the epithelial cells. The radicular cyst basically originates due to inflammation which is present in the periapical area. Epithelial cell rests of Melisses proliferate under the necrotic infected pulp and the radicular cyst arises. It is the most common type of all the jawbone cysts. Around 52 to 68% of all the cysts turn out to be radicular cyst. The most common sites are the anterior region of the maxilla and the premolar region in the mandible. Now let's move on and talk about the types of radicular cyst. So there are three types of radicular cysts. The periapical radicular cyst. In this, the cyst usually arises in the periapical area due to a necrotic pulp. Next is the lateral radicular cyst. In this, again, the pulp is going to be necrotic, but the inflammation enters the canal system from the lateral foramens. We're going to look at it in more detail in just a minute. Then we have the residual periapical cyst. Now, we usually find this type of cyst in the previous tooth extraction site. When the tissue is not properly curettaged, the inflammatory tissue remains, which leads to the formation of the residual cyst. Now let's look at it diagrammatically. Over here is the periapical radicular cyst, as the name shows us that it is present in the periapical area. Now when we look at the canal system more closely, we are going to find lateral foramens which open into the main canal system. So the infection may enter the lateral canals from the periodontal area if it is infected, and that leads to the formation of lateral radicular cyst. And then we have the residual periapical cyst, which usually arises from the inflammation which is present in the periapical area after the tooth has been removed and the area has not properly been cleared out. Now let's talk about the pathogenesis of the radicular cyst. It occurs in three phases. First of all, we have the initiation. Initiation means the starting of the cyst. So basically, there is going to be a carious lesion in the occlusal surface of the tooth. When this infection from the caries progresses, it enters the pulp canal chambers and the pulp canals. Eventually, this infection ends up in the periapical area and a periapical granuloma is formed. A periapical granuloma is basically an acute inflammatory reaction which is a resultant of the inflammation in the pulpal area. Now, after this, the macrophages are activated. These macrophages also produce lymphokines, interleukin 1, 6, and the tumor necrosis factor. Now, all of this is going to lead to the proliferation of the epithelial cell rests of Melisses. Now let's look at these in more detail. Over here, we have a tooth which is being formed. So over here in the surrounding area, we have the epithelial cell rests of Melisses, whereas just next to it is the Hertwig's epithelial root sheath. This is basically the combination of inner and the outer enamel epithelium, which occurs during the formation of the tooth. Now, the next phase is the cyst formation. Now, these epithelial cell rests of Melisses, which are present in the periapical area, proliferate to form a mass. When this mass is formed, the central cells are going to undergo liquefactive necrosis. This occurs because there is a nutritional deficiency in the center of the mass of the cells. There is oxygen deprivation, which leads to the release of hydrolytic enzymes, which causes cell death. Now, what happens next is a cystic cavity is formed. The cyst is lined by epithelial cells and it is surrounded by a cystic wall. And in between all of this, we have the lumen. Now, there are two types of cysts. A true cyst is a cavity which is completely enclosed in the epithelium lining. As we can see in this picture, that the true cyst is independent of the radicular canal system and it is present in the periapical area and it is completely enclosed in the epithelium lining. Whereas the pocket cyst, it contains the epithelial lining and it is open to the root canal system. So a radicular cyst is a true cyst. Now the last phase for the formation of the radicular cyst is the cyst expansion. So the cyst fluid is basically a collection of the inflammatory cells, exudate, and proteins. This creates a high osmolality in the lumen of the cyst, whereas outside the cyst there is low osmolality. The cystic wall is porous. Now what happens is, to balance out this osmolality, water moves into the lumen and a hydrostatic pressure is exerted on the inner walls of the cyst, and this causes the cyst to expand. Now, when this happens, prostaglandins are also released by the cyst. Now, these prostaglandins help to resorb the surrounding bone, which helps the cyst grow even more. Now, let's look at some of the clinical features of the radicular cyst. It is usually asymptomatic. But when we examine the oral cavity clinically, there is going to be a carious lesion. As the cyst increases in size, it may cause swelling and mild sensitivity. It may cause mobility in the affected tooth. It may also present as a soft, fluctuant, bluish mass, which is present beneath the mucosa. Now, this happens when the bone has eroded and it reduces to a thickness of eggshell. When we palpate the area, we may even hear an eggshell crackling sound. So that could be a diagnostic feature. Now let's look at the radiographical features. The periapical radicular cyst usually presents as a round radiolucency which encircles the affected tooth apex. There is also loss of lamina dura. Lamina dura is basically a radiographical feature. We can only see this on the radiograph. It is basically the alveolar crust which surrounds the root of the tooth. And the loss of lamina dura occurs due to the resorption of the alveolar crust, which occurs due to prostaglandins, as we discussed before. There may also be root resorption in the area surrounding the periapical cyst. The lateral radicular cyst also presents as a radiolucency along the lateral aspect of the tooth, as we can see in this picture. There is also loss of lamina dura. In the residual radicular cyst, there is a radiolucency which is present in the alveolar ridge and it may be round to oval in shape. As the cyst ages, the cellular contents in the lumen, they degenerate, and this causes dystrophic calcification, which is basically the deposition of calcium. So we may see some speckled radio opacity within the radiolucency, as we can see in this picture. Histopathology. Now, when we look at the cyst microscopically, we are going to find the lumen, the capsule, and the epithelial lining. The epithelial lining is basically the stratified squamous epithelium. There is a presence of Rushton bodies. This is basically linear or arch-shaped calcifications which form due to inflammation. We are also going to find some mucus cells. Mucus cells are basically formed due to metaplasia, and metaplasia is basically the replacement of one cell type with another. Now let's look at the histopathology of the capsule. The capsule is basically made up of collagenous fibrous connective tissue. It also contains inflammatory cells like lymphocytes, neutrophils, plasma cells, and histiocytes. We are also going to find cholesterol clefts. These are formed due to the disintegrating RBCs present due to the inflammation. Now, The lumen consists of fluid, which is watery and opalescent. Protein content appears as the eosinophilic material. These are the tiny pink specks that we see in this picture. Now let's move on and see how we are going to treat the radicular cyst. Now the treatment is done according to the diameter of the periapical lesion. If it is less than 2 centimeters in diameter, then conservative treatment approach is used. Root canal therapy is done to eliminate the bacteria from the canal system, and then the roots are filled up to avoid any reinfection. Eventually, the periapical cyst heals itself once the infection is removed. But if the cyst measures more than 2 centimeters in diameter, then we move on to surgical treatment like enucleation. Enucleation removes the cystic capsule completely and prevents any reoccurrence. Over here, we can see the enucleation spoon. It is going to remove the cyst completely from the periapical area. We can also carry out marsupialization. Basically, an incision is made in the cystic wall. When this incision is made, the boundaries of the cystic lining are sutured to the surrounding oral mucosa, as we can see in this picture. Now, the contents of the cyst are cleared out and it is thoroughly irrigated. The cyst is then left open for continuous drainage until the mucosal lining completely heals within 2 weeks. So guys, this was everything about the radicular cyst. I hope this was very informative for you guys. Thank you.